Deutetrabenazine, also known as Austedo XR, is a medication used to reduce involuntary movements caused by Huntington's disease, as well as treat involuntary movements of the face, tongue, or other body parts known as tardive dyskinesia. By decreasing these involuntary movements, it can help individuals take part in more of their normal daily activities. This medication works by decreasing the amount of certain natural substances in the brain that affect how nerves and muscles work, such as dopamine, serotonin, and norepinephrine. The Austedo XR titration kit includes tablets with different strengths, 6 mg, 12 mg, and 24 mg, to be taken over the course of 4 weeks to gradually increase the dosage. It is important to follow the prescribed dosage and titration schedule provided by your healthcare provider. It is usually taken once daily with food, and the optimal time to take it may vary depending on individual needs and preferences. Before you begin taking Austedo XR titration kit, be sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Swallow the tablets whole and do not crush, chew, or break them. The dosage will be based on your medical condition and response to treatment, and your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to take this medication regularly at the same time each day to get the most benefit from it. If you have any concerns about your progress, be sure to talk to your doctor. As with any medication, Austedo XR titration kit may cause some side effects. These can include drowsiness, trouble sleeping, tiredness, dizziness, nausea, or vomiting. If any of these effects persist or worsen, it's important to let your doctor know. Your doctor may need to adjust your dose to help reduce these side effects. To minimize the risk of dizziness and lightheadedness, make sure to get up slowly when moving from a sitting or lying position to standing. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's important to inform your doctor immediately if you experience any serious side effects, such as agitation/restlessness, symptoms of Parkinson's disease, mental/mood changes, trouble swallowing, or uncontrolled muscle movements of the face. In rare cases, this medication may cause a very serious condition called neuroleptic malignant syndrome, NMS. Seek medical help right away if you experience symptoms such as fever, muscle stiffness/pain/weakness, severe confusion, or fast/irregular heartbeat. While rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. If you have Huntington's disease, deutetrabenazine can sometimes increase the risk of depression and suicidal thoughts/attempts. This is a serious concern because people with Huntington's disease are already more likely to have depression and suicidal thoughts/attempts. It is important to talk with your doctor about the risks and benefits of this medication. If you have Huntington's disease and depression, you must not use deutetrabenazine if you are not being treated for depression or if you still have symptoms of depression with medication/treatment. If you or your family/caregivers notice that you have new or worsening symptoms of depression, sadness, loss of interest in activities you used to enjoy, suicidal thoughts/attempts, or other mental/mood/behavior changes, such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, or hostile/angry feelings, it is crucial to tell your doctor right away. Before starting Austedo XR titration kit, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have a history of breast cancer, liver problems, or certain heart problems. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana, which can intensify these effects. It's also important to avoid activities that require alertness until you can do them safely. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently taking. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication while breastfeeding. It's important to be aware of any potential drug interactions that may occur while taking Austedo XR titration kit. Make sure to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. This includes medications such as isocarboxazid, linezolid, and selegiline. It's also important to avoid using medications containing tetrabenazine while taking Austedo XR titration kit. Always consult your doctor before starting or stopping any medications while on this treatment. If someone has taken too much Austedo XR and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include muscle stiffness or pain, fixed upward position of the eyeballs, sweating, dizziness, and severe drowsiness. It's crucial to get medical attention right away if you or someone else has taken too much Austedo XR. This medication should not be shared with others. It is important to follow the prescribed dosage and titration schedule as recommended by your healthcare provider. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take double the dose to make up for the missed one. When storing Austedo XR titration kit, make sure to keep it at room temperature away from light and moisture. It's important to also keep the drying agent, desiccant, in the bottle. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the product and it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.